aspect that still baffles me is the constituency allowance that's given to members of the House of Assembly. These are individuals representing the populace, but they get an allocation to go and do projects, ill-defined projects. At times it's in the budget, but they allocate so much to it. But when you go to some places and see what's been delivered, so these are the areas where openness, transparency, honesty has to come into governance. So effectively, we're talking about good governance, putting in a framework that, yes, even if it's a little money, if Rwanda can do it after the war they went through, why can't we as a nation do it? But I'm an optimist, and I think putting the right people in the right positions will help us. That much I can say. History will tell us how far we've gone in the next few years.
Well, I think that's you've come to a crucible there, because I mean you're looking at the translation of national policy on health, which is supposed to be backed by budgetary provision, and then how it trickles down to the executive, down to filter to reach the people. If by the Abuja Declaration of 2001, countries in Africa had said that 15% of the countries of each country's GDP will be allocated to health, and as far as I know, 15% is 2 digits. As far as I know, ever since that time, it's not been 2 digits. In fact, the best I have on record seems to have been in 2015, which had 6.24%, which is just...
That's correct. Nigeria, yes, we pride ourselves as called the giant of Africa. We haven't been doing very well in terms of meeting that Abuja Declaration. There are other African countries that spend up to 10%, 12% of their
even
GDP.
17.
Yes.
Rwanda did it.
Rwanda did it. Yeah. Health is expensive, and you've got to invest in health. But we are not doing that. And until we put money into the health sector, then we'll still be where we are. If you look at the malaria issue in Nigeria, we had the benefit of having the benefactors of Bill Gates Foundation, the rollover malaria program, the mosquito net program. All of that has helped, and that's because money has been put into that. Polio in Nigeria, we've had a lot of vaccination, people interested in eradicating polio. Gavi is a company that provides vaccines.
This is okay.
Yeah, and they hold the government accountable. And because of that, again, the incidence of polio in Nigeria has gone down. Unfortunately, we've had a few cases recently, and that's due to what's going on in the northeast of Nigeria, where you have the Boko Haram. You can't get to the people, you cannot vaccinate them, and when they migrate out of there, then it gets into society again.
As somebody with a business bent and also a legal bent to the practice of medicine, how do we want to envisage, to score the public responsibility of government, of the legislature, of the executive, as failing in the health sector? Because when the health sector has failed, it is an indice of insecurity. Why? Because you've got under the MUG health also includes poverty alleviation, food, provision of food, so that the collaboration. If people won't collaborate with you, or you're too unreachable But then how can the masses, how can the 170 million people lay claims? And then that will lead to which I'll put forward to you next. The NHIS itself. When there is a massive poverty already on the ground, how can people pay for health services? Why wouldn't the private hospitals thrive? How much are the private hospitals? I mean, actually taking as fees for medical services. Are they as good as we think they really are?
Not necessarily. Yeah. Talking about the NHIS, the insurance scheme, National Health Insurance Scheme, it's a scheme that's been talked about for a long time in Nigeria, but it's made progress, but the coverage in terms of who is covered is still very low, possibly about 6% of the population. And you have different types of insurance scheme. It's easy to take money off government employers, people in the public sector, people in the armed forces. Yeah, government puts in about, I think, 3.75%.
Yeah, they don't pay as you earn.
Yes, pay as you earn. Then 1.5% of your salary goes into that scheme. So that when you need health services, you don't have to pay for it. So that's getting grounds, but it's very slow. The coverage so far isn't as widespread as it should be. There was a conference, I think last week, in Abuja, looking at this, so government is still talking about it. Management of health is complex. There's money in the NHIS, but is it getting to the end user? Are they aware? How do you use it? I mean, one of the schemes I talk about is Nigerians like to talk on the telephone. If, for example, one call of a 10-minute call or a 1-minute call goes into my own private insurance pot, so that when I need healthcare, at least there's some money there. So I think we've just got to be innovative in how we fund health in Nigeria. Government alone cannot do it. Accountability is important. Very difficult to talk about what's going on in the NHS at the moment. There are 8 officers who've been suspended, so I can't say more than that because there's an investigation going on.
Okay.
And we don't know what the outcome will be. But the allegations are that they have misappropriated the funds or maybe spent it. It's an allegation. It's not been proven yet.
Okay.
So that's why they are on suspension. Hopefully we'll find out what the outcome is. And if the money is used judiciously, there's a lot of money in the NHS at the moment. But if it hasn't been used judiciously, perhaps they don't even know where it should go, how to disburse it. And it might just be sitting in the bank, generating interest. But the current health minister is a good administrator. I would expect that, I mean, he will look into what's going on there and hopefully put things right. Whether you can do that in a 4-year term or 8-year term is difficult. And you've also got, good governance is not just one term. It's a continuous thing. And until we hold Nigerians accountable, you spoke about the populace. Nigerians take a lot. We don't grumble. It's God's will, inshallah. And we don't hold our politicians accountable for what they do. But things are improving. For example, the government has said no public officer or politician should go abroad for treatment if the service is available in Nigeria. And then Nigeria spends about $800 million on medical treatment. That's correct, yeah. $800 million is a lot of money that's been invested in other countries. If we kept that money in Nigeria, have good centers of practice, then we don't need to go abroad for treatment.
Even if we don't have this money, largely the funders to the NHIS have been government workers who have no choice but have the salaries deducted.
That's right.
But then we also have the private sector. That's if not the unorganized private sector, the organized private sector, where we have the Cadburys, the Nestle's, the Dunlops, the banks, where they have an above average wage coming into them, and they are not taxed. And where they are, and with all this under the PPP, we have private hospitals listed as agencies of the NHIS to determine. So, have they actually tried anything to bring in all these people into catchment to increase the revenue base of the NHIS? And then it becomes tragic, very tragic, that you have so much money and there is no idea what to seriously do with it. So much so that the possibility that somebody could be pilfering the money becomes a very topical issue like this. It's tragic. Is it that we don't have medical administrators, or we don't have a blueprint for health development from the National Planning Commission?
Health economics. How many people are into health economics? How many people are putting the round peg in the round hole? Those are the issues. Yes, you could appoint people based on what state they come from, but are they the best people to manage such resources? Perhaps not. Talking of the NHIS, you spoke about the private sector, Cadbury's and Co. Yeah, they have their own type of pooled scheme where they deduct money and it goes into health management organizations. You know, this private sector, they use private hospitals. So when they go to private hospitals, they get paid through the HMO, the health management organizations. So that's one area. Again, it's not perfect. Still in its infancy, it has its problems. But if we look inwards, where are the stumbling blocks or where are the holes in the system and plug it, then it will be a better run system. I think it took the UK government, the NHS has been in existence, I can't remember when, but for a long time, 60 years now. And it's a gradual process of improvement. The good thing is they're looking inwards, they're looking at results, holding people accountable. In Nigeria, the heads of institutions are not held accountable. People are given money, budget, nobody's looking at the outcome. But nowadays, people are talking about it. I'm aware that UCH, Ibadan, University College Hospital Ibadan, is now beginning to look at its mortality rate. So why are people dying? And learning from such exercise. The NHS, the National Health Act, which was signed in 1994, is supposed to look at all of these things. A framework of governance, provision of quality services, the training of nurses and midwives. Again, this has to be through legislation, the state government stepping up into all of this. But for as long as we have politicians who have access to treatment abroad, then they tend not to pay attention. Like we said, 6% rather than 15%. 800 million going out of the country rather than being used in the country. That situation is untenable. It should not be allowed to continue. If we invest in health, if we ensure that there's good governance, and if people are held accountable for their actions, things will improve. You mentioned something about the legal aspect of care. It's not about punishing people, but it's learning from the services. If you deliver poor services, you've heard of the Francis inquiry here, You've seen how it's changed things. We need something like that back at home where people look at why are people dying in your hospital? How can we help you? If it's a persistent failure or willful negligence, that's a different story. But it's how do we learn from a death?
Okay.
Yeah, but in Nigeria, like we said, people said, let's leave it to God.
Now, let me just take you to this quickly because we will soon be running out of time. I want to look at the issue of responsibility. When people leave government hospitals for reasons because they maybe they have money and then go to private hospitals which are deemed to be specialist hospitals, and they still don't come out any better. We have people from private hospitals who we've had reported deaths occurring where private hospitals they treated from malaria when in fact they have typhoid, and then they come back and people have lost lives. There's been so much anomalies like this as occurred one time too many, and if there's a word like 3 many, put that. Yeah, but why can't we hold them responsible?
It's a sad situation.
Because they pay for these services and they don't pay to get killed.
Well, there's no openness about these things. Patients trust doctors. And when you tell a patient that we did the best, this is what happened, Nigerians tend to take it at face value. And it was the situation in the Western world years ago where things were swept under the carpet. But you've got to be open with your patients. And the only way we will improve health service in Nigeria, the quality, is when you learn from mistakes. We're human. We will make mistakes, but how do you prevent it from happening to the next person? That's where, again, we have to look into. The Medical and Dental Council of Nigeria, they do have a few cases that are reported to them, and they do take action. Doctors have been struck off in Nigeria, but it's not about the striking off, but it's about learning. You will only be struck off if you're persistently negligent, willful negligence, but one bad day at the office, you won't be crucified for that. You'll just be told you learned from your mistake. So I would love to see more focus on patient safety. Again, empowering patients and Nigerian citizens to know their rights, what to expect from their health services, what to expect from the government. Here we've got a tiny little booklet called Good Medical Practice. What is expected of a doctor? What is expected of a nurse? There are those documents in Nigeria, but how many people read it? How many people affect it?
Are they even circulated at all?
Well, that's another
thing, because again,
if it's not available, I've been on the website, there's not much information there. But I think we'll get to a stage with the internet. The world is a small village. People are seeing what's going on, and you can see patients will start raising their voices in years to come. Again, we as professionals have to be advocates for our patients. We have to talk and say this is not good enough.
Okay, now let's look at this. I'm going to bundle this because it's going to be probably the last before we just wrap up. There is a situation where that Nigeria needs over 10,000 medical doctors. Otherwise, we're heading straight into probably not just a death, but a pandemic of healthcare crisis. And we need this. And if you look at the fact that it takes about 7 to 8 years to train a doctor, and with all the plethora of tertiary institutions now, some of them turning off poor quality education and therefore poor quality students as well, you begin to ask yourself, what can we do? And to make matters worse is also the fact that whether the students, the hospitals, whichever categorized medical delivery institution it is, also needs power.
Now, you talk of the number of doctors needed in Nigeria. The number of medical schools used to be maybe 4. With private institutions now, there's so many medical schools. There are medical graduates of different quality. But before you can become a fully fledged doctor, you've got to undergo your internship, housemanship. There are a lot of Nigerian graduates, medical graduates, who have no placings. So no hospital to take them for their training, because not every hospital is accredited to train house officers. But what the government is trying to do at the moment is to try and make sure that medical graduates get placings for their training, for their 12-month training, to move on to higher levels. So it's still a complex, disjointed system. There's the National Universities Commission, and they're talking to the Ministry of Health. I'm not sure, I don't know. I'm not saying they're not. But I would expect there will be some improvement. The current health minister is a doctor. Well, I haven't said that. Previous health ministers
I've all been doctors.
Apart from me, Tayo Lambo,
Okay.
who was not a doctor, was an economist. Professor Kuti, he focused on primary healthcare and did a good job of it. But like I said, I'm an optimist. I will, and I would expect my colleagues to continue to advocate, to be a voice for the patient.
In one sentence, do you see a medical personnel crisis looming in Nigeria with the current trends of affairs, given all the many factors that we have today?
Well, in one sentence is short. What I will tell you is there are lots of Nigerian healthcare professionals out of the country. Government is trying to do the reverse, brain gain. Yeah, to encourage Nigerian healthcare professionals in the diaspora to come home to render service, to transfer their skills and knowledge to the local people. And one day we'll get it right. But my key, maybe final sentence will be, unless there's a proper framework of governance where you hold people accountable for the services they deliver, where you ensure that the services are high quality, then we'll still be where we are.
Oh, yeah. Thank you very much, Professor.
Thank you.
It's been such a pleasure having you around. I don't know, we will need to bring you back again some other time, because we left several things still hanging here, which we want to recap with the benefit of your experience over time, and you know as well. Ladies and gentlemen, it's been such a wonderful time today, trying to find out exactly what Nigeria is about. It doesn't look exactly too rosy, but if Professor Jaiyesimi is an incredible optimist and is a competent medical technocrat here, so perhaps we should be optimistic and follow his trend, and that's more reason why next time we're going to bring him around, we need to get you also involved. Thank you very much, Prof.
Thank you for having me.
Thank you very much. And over here from Africa Live at the Africa Media Hub, it's Peter Olonishomo signing off. God bless you. Till next time.